Today on the show, I'm really excited to have Quinn Haisley. Hi, Quinn.
Hi, how's it going?
It's so good to have you here.
Good to
So,
be here.
why don't we get started by just explaining what you do and how you got into this work?
Yeah, totally. So I am a registered dietitian. I work out of New York City. I own my own private practice that I work out of. It's called Practice Eros Nutrition. And currently, the practice that I work at, I primarily work with clients who are either LGBTQ identified or who are neurodivergent and are in eating disorder recovery. I've worked in the eating disorder field for like a little over 4 years now. I started out at an outpatient clinic in Manhattan where I was working at the PHP, IOP, and a little bit in the outpatient levels of care for eating disorder treatment. Yeah, it's been kind of a passion project of mine to start a private practice where I get to work with queer folks just because I identify as being queer. And so it's lovely to be able to work with clients who have similar lived experiences as myself.
Yeah, that's amazing. And did you also struggle with your own eating disorder as well?
I did, yes, growing up. And like a lot of people got into nutrition because I had an eating disorder. And then through both nutrition education and also just obviously like therapy, working through my own things, was able to get to a stable place in eating disorder recovery. And yeah, now again, love working with people who are like hoping to find a simpler thing.
That's amazing. Yeah, to have your own experience not only with an eating disorder, but also identifying as queer and being able to really relate to people in that way. And you just bring a unique perspective. And I have so many questions to ask you. So we'll just kind of get
Yes.
started and see what we explore. So,
Awesome.
as more research has come out that shows that the eating disorder rates are disproportionately higher in people who identify as LGBTQ. And there are a lot of proposed reasons for this. Nobody can really pin down like exactly why, but can you talk about some of the reasons you think this is the case?
Yeah, of course. And I think like a lot of people who have been doing research in this, it seems like it's a multifaceted reason that there's many contributing factors. I think just like any sort of reasoning for development of eating disorders, that it's usually never just one thing, that there's a lot of things that are going into it. A few of the reasons that I think are most common to see for people who are in the LGBTQ community to develop an eating disorder, one is just being a minority, that we know that for people who have marginalized identities, that both just the stress of having a marginalized identity and then feeling ostracized either in society, by family members, friends, anything like that, that adds not only stress, but I think brings up a feeling of wanting to have some semblance of control. And so I think an eating disorder can develop, one, if somebody is just looking for a way to control their life, if it feels like other parts of their life are feeling out of control. Um, Also, I'm very big into polyvagal theory and how the vagus nerve kind of interacts with the body and interacts with the gut and stress. And we do see that for people who are experiencing minority stress, particularly, so like anybody who has a marginalized identity, that the development of something like an eating disorder can help to regulate the body when the body is in kind of this like chronic state of stress from being oppressed in society. So that I think is a huge contributing factor. A couple of other factors would be that people who are LGBTQ identified tend to have higher rates of being unhoused or food insecure, which can be a trigger to an eating disorder or disordered eating. We also tend to see that LGBTQ identified people might not have the same support systems that people outside of the community might have, which can also contribute to. And then really for especially our trans and gender nonconforming folks, if they don't have access to gender affirming care, things like hormone replacement therapy or surgery, that they might utilize an eating disorder to shift what their body looks like to better fit their own gender identity.
Yeah. Yeah, it seems like a lot of the factors relate to stress and relate to just kind of turning a negative attention toward your body and therefore maybe trying to change it in ways that involve food or restricting food. And as we know, that leads to eating disorders when you start depriving the body of food. And yeah, it just seems like for these populations, there are a lot of those risk factors. Yeah, something I read was that 9 out of 10 LGBTQ youth have body dissatisfaction. Do you find that that is also a factor in these populations as far as how it develops? Like, I want to change my body in some way.
I do, yeah. And I think what's interesting, especially as somebody who has both worked with LGBTQ adolescents and then also people who came out later in life, that I think for the folks that I've worked with who come out later in life, there isn't always that immediate connection of like, oh, that's what was happening when I was an
Mm,
adolescent, that I was like trying to control my body or was trying to stop something from happening.
mm,
Um, but I think later in life, there's thinking about it and processing through it and being in therapy and being like, oh, that's actually what was going on when
right.
I was younger, was I was like trying to control my body through the eating disorder. And some of it's connected again to gender identity. I've also had a number of clients where in adolescence, this idea of if I don't go through puberty, I also won't experience certain sexual attraction to people. And that can be a way of if I don't feel comfortable with that or it doesn't feel safe to express my sexual attraction to other people because of being in the LGBTQ community, that's one way where it feels like somebody might be able to try to stop it. So I see that a lot. I do think that for the LGBTQ identified youth and adults that I've worked with, that like puberty time tends to be a really pivotal moment for a lot of people with the development of an eating disorder.
Yeah. Yeah, it's such a good point. And it's such a difficult time for anyone, right? Because the body is
Yeah.
changing. Just from my own perspective, I identify as my biological gender. There was a certain set of pressures or a way you're supposed to look. And as
Mm.
puberty comes, you're like, oh gosh, there are certain standards I need to meet. And it becomes very stressful. And I would imagine there's even more of that or different that shows up differently in different people depending on your identification or your gender or sexuality. I just think, yeah, that whole time is very pivotal of puberty,
Mhm.
adolescence, becoming an adult. And if you're struggling with your sexuality, gender, I can imagine it would only be harder.
Yeah, definitely see that.
And also, as we're talking about sort of these cultural standards, how does that show up as far as, recovering from an eating disorder or even just knowing that you have an eating disorder? Like, it seems like maybe there's some unrealistic cultural standards that are different depending on your identification.
I think this is really interesting, and it's a topic that I bring up a lot with my LGBTQ identified clients, that I think we have sort of these like cis het normative idealizations of what like a body should look like and what's acceptable. And then I think that the queer community has their own idealizations of what a body should look like. And those are not always the same thing. But then I think that people who are in the LGBTQ community find themselves trying to fit both of these standards, which can feel so impossible. Like a very good example would be um I have some trans mask clients, and they always bring up the actor Elliot Page as sort of this like idealized body standard of what a trans masculine person should look like, where they're like very sort of thin. There's a lot of like muscle tone going on. And so I think that queer people, even if they're not always trying to fit into like a cis heteronormative beauty standard, still can get very caught up in sort of different beauty standards that happen within the queer community.
Yeah, that's so interesting. And I think people that work with people with eating disorders and even myself sometimes make the assumption, oh, you must be just trying to fit the norm, the cultural norm of your biological gender, your gender at
Mhm.
birth. And I think that's a incorrect assumption to make. And so I think you opening, people's eyes to, hey, there's different standards that people may be trying to meet. There's all these different images that are in Hollywood or in the media about what a trans individual should look like. And yeah, I think it's just about not making assumptions on why someone might be trying to change their body in certain ways.
Yeah, absolutely.
So, as we talk about bodies, can we talk a little about the difference between gender dysphoria and body dysmorphia? Because I have a lot of questions surrounding that.
That's definitely, I think a lot of people end up with a lot of questions about that. The way that I usually describe it is that for people who are experiencing gender dysphoria and body dysmorphia, that you can very much be experiencing both at the same time. And there can definitely be overlap between the two, but that they are separate and the treatment of them can be separate as well. For body dysmorphia, that's really going to be anybody who has significant body dissatisfaction that's like impacting their quality of life, it's impacting self esteem. And that can be more related to either not really seeing your body for how it actually looks, or being like specifically targeting specific parts of your body that you feel like incredibly uncomfortable with. For somebody who's experiencing gender dysphoria, it's sort of similar, but it's more targeted towards specific aspects of somebody's not only body, but also could be things like style, hair, name, pronouns, anything like that that's going to feel like it is not affirming of somebody's gender identity. So I think with body dysmorphia, again, it's much more focused on the body and physical aspects of the body versus gender dysphoria, which can, again, very much be involving the body, but there's a lot of other things that go along with gender dysphoria.
Yeah, I think it's interesting how you said they're separate because I can imagine, especially in eating disorder recovery, that they might get combined, maybe incorrectly. Like,
Yeah.
and I know in eating disorder recovery, we try to tell people to learn to accept their body and like accept their natural weight and how their body naturally shows up. And I can imagine that that may create a contradiction in some ways to treating gender issues because I guess I don't know how to ask the question, but it seems sometimes like a
Yeah.
contradiction.
And I think it can definitely be a contradiction. Again, a good example that I think comes up a lot is that if I have a client who just has body dysmorphia, I would never suggest to them that they go get plastic surgery to try to fix their body dysmorphia. Like, we know that that's not going to work. That doesn't actually get to the root of the issue. It's not going to be useful. That person could very easily get surgery and still be incredibly dissatisfied with their body. So I would never give that recommendation to somebody. But if I have a client who is experiencing gender dysphoria, a conversation that we might have is around gender affirming surgery. Like, do they want top surgery? Do they want bottom surgery? And usually, what I see with my clients who get gender affirming surgery who are in eating disorder recovery is that it's not a fix all. It's not going to like completely recover somebody from an eating disorder. It's not going to fix all of their body image issues, but it can make a huge difference as far as how comfortable they feel in their body. And it can also sometimes reduce eating disorder symptoms because somebody is feeling more comfortable in their body. So I think that's a huge distinction to make. And I do see that being a mistake sometimes in eating disorder recovery, that again, I think with the best of intentions, people who are helping those in recovery saying things like, you just need to work on body neutrality and body acceptance.
Mhm.
And for trans or gender nonconforming people, like that doesn't feel realistic all the time to get to that. And doing things like gender affirming medical care can make a huge beneficial impact for them.
Yeah, it's kind of learning what the individual needs to learn to accept as far as maybe their weight or their natural body
Mhm.
shape, and then like what can safely be addressed, possibly through medical care or other avenues that would actually help their body image. It's a fine line between what do we need to kind of fix or make more in line
Mhm.
with how the person sees themselves, or what do we learn to accept? And I don't, that line may not always be clear. So I like that you see the nuance in that and really try to work with people on both.
Yeah. And again, whenever somebody is considering getting gender affirming medical care, especially something like surgery, that should be a distinct conversation between themselves and their treatment team. Like, I don't think anybody should be taking that conversation lightly. And I know for all my clients who are in eating disorder recovery, when we are approaching the possibility of getting surgery done, like I'm involved, a therapist is involved, sometimes a psychiatrist is involved, a doctor is involved, like a lot of people are involved in that conversation so that we can really work on that distinction between what feels like it's related to the gender dysphoria versus what might be more related to something like body dysmorphia.
Yeah. Yeah, that makes a lot of sense because it is not something to be taken lightly, especially considering the medical complications that people with eating disorders often have. So undertaking something like a surgery would be something that really would have to be discussed with the doctor, with the medical team, with someone like yourself. So yeah, that makes a lot of sense. Something I often try to teach people is that like a lot of my approach is based around the brain and that we all have this sort of primitive brain inside of us and more of that rational human brain, and when we don't eat enough it triggers this primitive system, and this kind of happens to all of us regardless of gender, sexuality, identity, anything that may be going on in our life. When we don't eat enough, we want to eat a lot of food. People get involved in binge eating, or some people go the opposite way in the anorexia route, but a high percentage of people have this primitive survival reaction, start eating a lot of food. Binge eating becomes very reinforcing. My point is here is like I try to teach people like, hey, everyone's kind of the same in that we have this primitive system inside of us, regardless of what is going on in your life and kind of what you're struggling with. And you can learn to overcome this, desire to either restrict your food or binge, kind of regardless of whether or not you have the rest of your life figured out. So that's like my approach in a nutshell. But in order to recover, in order to overcome this, you have to learn to nourish your body. You have to learn to eat enough. You can't stay in that survival restricted state to recover. And I find that there are so many different issues that get in the way of people eating enough, that get in the way of people really allowing themselves to nourish their body. And I think that this is one of them, like the LGBTQ issues and gender and sexuality and everything that goes along with that is really something that can interfere with someone's desire and ability to nourish their body and eat enough food. And, I hope that's all making sense, but I want to get your perspective on that as far as, do you feel like this is something that gets in the way of them eating enough food? And then how do you help them to learn to nourish themselves again, as a nutritionist?
Yeah. First off, yes, I definitely agree. I think that being in the LGBTQ community can, for various reasons, act as a barrier to somebody feeling like they have the ability to nourish themselves adequately. I think sometimes restriction or even binging can show up almost as a self-harm behavior where it's like, I don't deserve to eat enough or I don't deserve to take care of my body. I think that that can come from a lot of different places. Sometimes it's just like this deep self-loathing that feels like it has been taught to somebody of like, you should not love yourself, that you are somehow wrong. And so I think if somebody has gotten that messaging at any point in their life, that behaviors like that can come up, and the inability to really see themselves as somebody who's like deserves to take care of themselves and nourish their body, that that can definitely get in the way of somebody being able to eat enough or be able to like have consistent enough eating patterns that things like binging don't come up. um I think also, again, just talking about restriction and binging being two behaviors that can be self-soothing for people. And so if somebody is dealing with like anxiety, depression, any sort of mental health issues, that utilizing either not eating or binge eating as a self-soothing behavior can come up for a lot of people too. And so I think that very much, unless somebody is also working on other mental health issues simultaneously, can feel really hard to try to nourish yourself adequately throughout the day because of that.
Yeah. Yeah, that makes a lot of sense. I like what you brought up about the person not feeling like they're deserving of enough food. And it's
Mhm.
heartbreaking. And I see that in people I work with as well, is thinking like, I don't deserve to eat enough, or I don't deserve to stop binging. And I think it's something that, yeah, I mean, it's great that people like you are out there working with people and convincing them of their worth and that they absolutely deserve self-care and to be able to eat enough, and then to be able to learn how to not follow that drive to binge as well, because that is ultimately, even though it can feel self-soothing in the moment, it's ultimately a harmful behavior, that brings up shame, that brings up health consequences. So how do you work with people as far as stopping binging?
Think my biggest thing always with binging is figuring out if there's any restriction going on simultaneously, because
Yeah.
we see this pretty consistently with anybody who has binge eating behaviors, that at some point there is also usually some level of restriction going on, even if that's just like earlier in the day somebody is not eating consistently and then they're binging at night, or they have days during their week where they're trying to restrict their food intake and then they kind of break down and binge later in the week, things like that. It's incredibly common. And so, step one for anybody that I'm working with who has binge eating going on is to make sure that they're eating consistently and that they're feeding their body enough throughout the day and throughout the week. And I think that can feel really scary for somebody who experiences binge eating, because the idea of binging and then waking up the next day and eating breakfast can feel really scary, because it feels like I'm quote unquote like messed up, and so I have to fix it by not eating the next day or something like that. And so I think you can very easily just get trapped in this sort of cycle of restriction and then binging. And so eating consistently and making sure that somebody's eating enough earlier in the day or earlier in the week or wherever the restriction might pop up is always like the first line step for me for anybody who's experiencing binge eating.
Yeah. Yeah, and that's so helpful to hear, and I know that my listeners will take that to heart, because I'm always telling them you have to eat enough to stop binging. And it's what gets back to what I was talking about before, is anything that interferes with you eating enough food is so important to look at. And there's been so many things I've talked about on the podcast. Like, something that affected me was being an athlete, and athletes
Mm.
have really high rates of eating disorders. Like, in female athletes,
Mhm.
it's up to like 45% in some studies. There's some discrepancies in the research, but anything that's like you're forcing your body into a certain form or shape, or you think it has to be, and there's so many groups that face this, and I think LGBTQ community is facing it in a different way that not all of us think about. I think some people think about, oh, like the female cultural standard, like that's what an eating disorder is all about, or even the
Yeah.
female athlete standard, that's what it's all. No, it's not. It's so many different people. And maybe we could talk about sexuality a bit as well. I know that,
Yeah.
for example, in the gay male population, there's a very, very difficult body standard that not many people can make. So the rates of eating disorders in gay males, I know, is very high as well.
Yeah, I say that a lot with the gay male population, that there's, again, I think it's less of like a even idealized body type in a cis heteronormative way. I think it is very much an idealized body type that you see with gay men, and trying to like fit that mold and be like, okay, I have to like look like this. And one of the ways that I'm going to try to look like that is by not eating enough. That like that is one of the ways. It's interesting because there's been like some theories as to whether or not like lesbian women have almost like a protective factor because they're not trying to like fit into sort of the male gaze in society. And we do see like to a certain extent it might be kind of a protective factor, but I find that like really anybody who is in the LGBTQ community, including like lesbians, bisexual people, are still kind of facing these queer body standards that can make it so that an eating disorder pops up to try to control what body it looks like.
Yeah, because even if you're trying to, let's say, put on weight to fit a certain standard, even like heterosexual cis males who are trying to put on weight and bulk up, and though they can end up with problems. So yeah, I can see how there's just so many different ways it shows up. And I just think it's important for any of us working in this field to just be aware of all the different ways it could show up. Could I ask you, what unique challenges do you see people in the LGBTQ community facing as they recover and as they start to heal from this?
Yeah, I think one of the biggest challenges that I see, that I hope as more people become like conscious of how it is to work with people who are within the LGBTQ community, that this will improve, is just language that like mental health, any sort of practitioner are using with their clients. Um, I totally understand that language, especially if somebody has gotten into the habit of like using specific language, that it can feel like it's really tough to start to shift that. But for my clients who are in the LGBTQ community, it means so much when clinicians use phrases and wording and language that feels really affirming to them. And that can be anything from, if I have a client, let's say, who comes to me and I'm talking about their partner, like they live with their partner, I'm using non-gendered language unless they start using gendered language, because I don't want to assume that I know the gender of their partner, because I don't know the gender of their partner. So even things like that, of I'm just going to use non-gendered language to talk about siblings, parents, partners, friends, anything like that that's in their life, until they use other language, and then I usually just mirror whatever language my client is using. And then very similar for things like names, pronouns. I find, especially with medical record systems, it can be really hard because insurance companies, different sorts of like hospitals, facilities need to have things like legal names put down on paperwork. But if somebody has changed their name or is going by a different name and they no longer use their original legal name, it can feel really triggering to see that, like what we would call a dead name. And so that things like that, that I think sometimes clinicians don't always understand like how impactful it is to somebody, and how non-affirming it feels when incorrect language is used, and how much it makes a difference for somebody to go to a clinician and have them just use affirming language whenever
Yeah.
they're talking to them, that can make such a huge difference in that person feeling like they can trust the clinician, feeling like they have good rapport with the clinician. And I think that's one of those things that like anybody could work on, that like regardless of how often you feel like you're working within the LGBTQ community, just trying to shift the language that we're using when we're working with clients can be really helpful.
Yeah. Do you find that that is something that prevents people from even seeking care sometimes in the first place?
I do. I find that I think one of it just comes from frustration, that if somebody has experienced it enough times, it turns into like, well, why would I even bother? I just know I'm going to have a terrible experience. So I'm just not going to go seek help for this thing because I'm never going to be able to find somebody who knows how to talk to me. Like that can come up. I also find, and this always breaks my heart when I hear this from clients, that they have to sort of pros, cons. Do I want to work with somebody who feels like they affirm my identity, or work with somebody who I feel like is good at their job in other ways? So like a doctor who I feel like really understands the medical condition that I have, but never gets my pronouns correctly, versus a doctor who maybe doesn't understand my medical condition, but uses my correct pronouns. And that should never be a question. Like
Yeah.
we should always have somebody who can do both, that like
Mhm.
understands your medical condition and also uses your correct pronouns. So I find that that is a deterrent for a lot of my clients, because again, just the exhaustion that I think comes along with having to correct somebody over and over again is a lot, and we should never put that expectation on the client to have to educate us constantly if
Yeah.
we're talking to them.
Yeah. Yeah, that makes a lot of sense. I appreciate you sharing that. What about any unique nutritional considerations, as a nutritionist working with this population?
Yeah. The main distinction that you're going to see as far as nutrition goes within the LGBTQ community is going to usually come up with anybody who's on hormone replacement therapy, or if you have an adolescent who's on puberty blockers, that those are the times where you're going to see some nutritional differences. So if somebody's on testosterone, estrogen, if they're taking like spironolactone, things like that can definitely alter somebody's nutritional needs first off, and it can also alter their risk level for certain chronic health conditions. For example, we typically see that if somebody has been on testosterone for, usually the timeline, again, research is not awesome. We need more research in this field. But usually, if somebody has been on hormone replacement therapy for around 6 months or longer, you'll start to see a shift in nutritional needs. So if somebody's been on testosterone for 6 months or longer, you'll see things like their resting metabolic rate is usually going to start to increase. You'll see a shift of like increased lean muscle mass versus fat mass in the body. You'll usually see like an increase in cholesterol levels, especially LDL cholesterol levels, which can put them at higher risk for heart disease. So I think it's really helpful for any sort of nutrition clinician to understand how things like HRT can impact the body, in case they do have any clients that come along.
Yeah, I'm sure not a lot of people in this field may even think about. So it's great that you're raising awareness about that. My sort of final question here is about prevention. Like, I think prevention of someone even starting to restrict their food, or limit their food intake, overeat in unhealthy ways. That's really the best way to prevent an eating disorder, right? These kids who are, like I said in the beginning, 9 out of 10 LGBTQ youth are unsatisfied with their bodies. What is a
Mhm.
way we could help them avoid going down this path with food to begin with?
Yeah, I think a huge thing to do is to make sure that, especially with adolescents, that they have spaces that they feel safe being themselves. And I think that can look like a lot of different spaces. It can be spaces like at home, space in school, space with friends, that having spaces like that, I find that for the general LGBTQ population, having safe spaces where people can talk about their own lived experience with things like body image, with eating disorders or disordered eating, that makes a huge difference.
I think we've come a long way as far as like body acceptance and learning
Mhm.
that there's many different size and shape bodies and being more body positive. But I don't know if that's fully translated into these more marginalized communities yet. It's like, okay, we can accept a body if it fits in a certain range that we're comfortable with, right? Like, and
Yes.
maybe, these other bodies aren't okay. So I think it is really about learning to accept all bodies and all genders and all sexualities, and that is something I think we still have a long way to go as a culture, but I'm glad there's people like you out there, speaking about this and raising awareness.
Yeah. Yes, I agree with you.
Yeah. Well, thank you so much, Quinn. It's been a pleasure talking to you.
It's been a pleasure to be here. Thanks for having me.